Hello, assalamu alaikum. Now I'm going to talk about COVID-19 virus. So let's go through it. Okay, COVID-19 virus is an infectious disease caused by severe acute respiratory syndrome coronavirus 2. The disease was first identified in 2019 in Wuhan, the capital of Hubei, China, and has since spread globally, resulting in the 2019-20 coronavirus pandemic.
How does coronavirus spread? Well, basically this virus spreads through human to human. I'll be explaining two ways about spreading the virus, but before I jump into my main point, I have to break a huge misconception about wearing mask. Well, wearing mask doesn't help you at all from getting infected with the virus, because this virus isn't there. This virus isn't hanging around with atmosphere, no. This virus could be in your hand. This virus could be on a doorknob. Well, I'm not suggesting take off your mask, but what I am suggesting, only wear mask if you have COVID-19 symptoms, especially if you are coughing or looking after someone. And another thing is, if you live in a polluted area, you must wear mask, whether the virus exists or not. Now come to the main point, how exactly does the virus spread? Number one, if you have close contact with someone who is already infected with the virus, you will get infected. Let's see how it works. There's a person who is infected with the virus, and if he sneezes on you and you breathe in some of his sneezing vapor, you will get infected. Number two, if you shake your hands with someone who is infected and then if you touch your mouth, nose or eyes, this virus will enter into your lungs and it will make you sick.
Now I'm going to talk about the symptoms of COVID-19 virus. Although those infected with virus may be asymptomatic means that if you are bearer of this COVID-19 virus but you don't have any kind of symptoms, like you don't show any kind of symptoms, but still this virus can be transferred from your body, or this virus can be transmitted from your body to another body if you get along with other person. And many develop flu-like symptoms including fever, cough and shortness of breath. Emergency symptoms include difficulty breathing, persistent chest pain or pressure, confusion, difficulty waking, and bluish face or lips. Immediate medical attention is advised if these symptoms are present. Less commonly, upper respiratory symptoms such as sneezing, runny nose, and sore throat may be seen. Symptoms such as nausea, vomiting, and diarrhea have been observed in varying percentages among people in several studies, with percentage varying from 3% to 31% of cases depending on the study. Like if you have some initial cases in China presented only chest tightness and palpitations. In some the disease may progress to pneumonia, multi-organ failure and death. As is common with the infections, there is a delay from when a person is infected with the virus to when they develop symptoms, known as incubation period. The incubation period for COVID-19 is typically 5 to 6 days, but may range from 2 to 14 days. Now I'm going to talk about the cure of this COVID-19 virus. Although no medicines have been proved to be worked in this case of virus, but some people claim that chloroquine and azithromycin may work for this virus, but there has been no proof, but it works for some patients. But if you take chloroquine more than 1 milligram of a day, you may die. So before taking the medications, you should consult with the doctor.
How to stay safe from the virus? Number one, wash your hands with alcohol-based hand rub and soap. The reason behind this, alcohol-based hand rub kills viruses that may be on your hand. Number two, maintain at least 1 meter distance between yourself and the person who is coughing or sneezing, because when someone coughs or sneezes, they spray some small liquid droplets from their mouth which may contain virus. Number 3, avoid touching eyes, nose and mouth, because your hands touch many surfaces and can pick up viruses. When your hands get contaminated, hands can transfer the virus to your eyes, nose and mouth. From there, the virus can enter into your body and can make you sick. Stay safe, stay at home.